Namaste. This is Dr. Anesh Jain, interventional cardiologist from Ruby Hall Clinic, Pune. Today I am going to speak about ABPM and its importance. ABPM, as the full form of ABPM, is ambulatory blood pressure monitoring. It provides a 24 account of patient's state and is useful for diagnosing primary and secondary hypertension. And it also helps in differentiating from white coat and masked hypertension. It is accurate in predicting the risk of cardiovascular disease and mortality. BP level measurement using home or ambulatory BP monitoring is recommended, with office BP classified as high normal or grade 1 hypertension, systolic being 130 to 159 millimeters of mercury and diastolic 85 to 99 millimeters of mercury. The practical use of ABPM is that it differs from the office or the clinic blood pressure monitoring is that ABPM helps in measurement of the blood pressure at home or maybe when you are going out in your daily routine. So it gives us an accurate reading of exactly what the blood pressure is of the patient when they are in their daily livelihood and not when it is actually in the hospital. So many a times what happens is when a person comes into the hospital, they get anxious or stressed because they don't know what is going to happen with them. And this anxiety leads to an increase in blood pressure, false increase in blood pressure, which is also known as white coat hypertension. So, ambulatory blood pressure monitoring, what it does is we attach the blood pressure cuff and we ask the patient to go out of the hospital and it keeps on measuring the blood pressure for 24 hours. So as a result we get the actual true reading without the stress or the anxiety which a patient or any individual faces when they come to the hospital. The ABPM usually provides the average of blood pressure readings over a defined period. We usually attach it for 24 hours. The device is programmed to record the blood pressure every 15 to 30 minutes, and an average blood pressure values are usually provided for the daytime, nighttime, and 24 hours. That means that when the patient goes to sleep or when an individual goes to sleep, the ABPM machine keeps on recording the blood pressure at night as well. A diary of patient's activity and sleep can also be recorded. A minimum of 70% usable BP recordings are required for a valid ABPM measurement session. ABPM values are on an average lower than office blood pressure values, and the threshold for diagnosing hypertension is also different. So, the diagnostic threshold for hypertension in ABPM is 130 by 80 over 24 hours. The daytime averages is 135 by 85, and the nighttime average is 120 by 70. These measurements are equivalent to a blood pressure, office blood pressure or clinic blood pressure reading of more than 140 by 90. So the thresholds are slightly decreased for an ABPM because there are many studies which have gone throughout, and it has been found that at this level of cutoff, it is usually we are able to differentiate between a hypertensive and a normotensive. The advantages of ABPM are it is a better predictor of hypertension mediated end organ damage than office blood pressure. The 24-hour blood pressure has been consistently shown to have a closer relationship with any side effects or any effects of hypertension which a patient faces. It is a more sensitive risk predictor than an office or a clinic blood pressure reading. It can identify white coat hypertension, as I had previously mentioned. It has a stronger prognostic value, and we can titrate the medications also accordingly. It gives nighttime readings as well. Measurement is in real life settings as compared to what we do it in a hospital, because all the individuals daily are in their daily livelihood and not in a hospital. So, a hospital blood pressure is not the true marker of actual blood pressure in a patient. It has abundant information over 24 hours and it gives nighttime blood pressure readings as well. The disadvantages, which if have to be put, is that it has limited availability as of now, and some patients do complain that it can be uncomfortable. Nowadays, ABPM has become an indispensable tool in diagnosis and management of hypertension and its therapy. Recent guidelines from ESC recommend that diagnosis of hypertension should be based on repeated office blood pressure measurements or an ABPM if it is available. ABPM gives a better diagnosis and better prognostic value as well. Analysis of various indices on the ABPM graph, such as the hyperbaric index, diurnal index, night dipping, and other indices can provide various information for patients who are already diagnosed with systemic hypertension, maybe having diabetes, chronic kidney disease, and other and so on. It can also be used to monitor the therapeutic efficacy of antihypertensive treatment, and we can also target at what time which medication has to be given based on the ABPM readings. ABPM is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help in directing treatment in such patients when required. So, as to summarize, ABPM readings can guide towards the prognosis underlying the organ damage and can be a useful predictor for a cardiovascular risk. As a new age cardiologist, I do recommend everyone, especially new patients, to at least undergo an ABPM before they take a decision of taking a blood pressure medication for lifetime, because correct diagnosis is very important, so that many young individuals, especially below 40, or for that matter below 50, are not taking medications unnecessarily, and they are taking the right medication at the right time. Thank you very much.